with 24 nurse aides have been trained and ready to go for pandemic response. Good morning, Doc.
Morning. Thanks for having me. And great work on getting the word out about the vaccine. I really appreciate that.
Did you get the vaccine?
No, not yet. Not yet. We want those frontliners, right, to go first.
Right.
Um,
So let's
yeah.
talk about this release that came out about the 24 new nursing aides.
Well, we was really a pilot and very innovative. So we were trying to keep it quiet until until they were through the program, and we didn't even recruit through social media or the regular media because we had already had an overwhelming response. So Sabrina, Jason, and Andy, you guys have covered the nursing shortage even prior to the pandemic, and you've been great about having the RNs on the link, and throughout the past couple years. But in the pandemic, it heightened the need for RNs. But in October, we had been talking to the hospitals, and I have a faculty that works at GMH, and so they were really relaying to us the terrible shortage in nursing assistants. And there are 4 programs on island. And in March, unfortunately, we had to stop our CNA program. We had one ongoing. They're usually a 2.5-month program. GCC also has a good one. Guam Mariana's training, and then Dodea. So we all stopped because it requires a lot of practicum, hands-on. You got to go to the hospital. And our clinical site was the GMH SNU. And we all know, that shut down, rightfully so. And to protect the safety of the patients, we could not do clinical there. And so our focus was really in March on getting our BSN students out, and then getting the rest of the BSNs continuing in the program. And so we've been doing a lot in that regard. But then in October, it kind of really hit us that our nursing assistants, that because all the programs shut down, there was this horrible shortage. And, in the mainland, the nursing assistants primarily work in nursing homes. And the nursing homes, in the history of COVID, right, the short history, the nursing homes have been hit the hardest in the mainland in the early months. And so the federal government allowed for facilities that hire nursing assistants to waive certain requirements. And so every state has a different requirement for how many hours it takes to train a CNA. Our program was about 160 hours. Guam requires 120 hours. And this includes the theory, the lab practice, and then, of course, the hands-on care at the bedside. But in the States, they allowed, a lot of states came up with this 8-hour online training, and nursing homes were struggling. I mean, really desperate situation. And so they were actually hiring people after an 8-hour online training, no faculty. Like, you just sign up and you take it online. And then the state of Colorado allowed for all their schools shut down, and they allowed for all students in existing CNA programs to take a 13 to 15-hour online course. And so we looked at it. We had an emergency meeting with the nurse leaders, and I got to tell you, GMH nurse administrators and GRMC and HSP, everybody dropped everything. And, I said, hey, can we have a quick meeting, and, can we find out what your shortage is? And when we met October 22nd, HSP, GMH, and GRMC had a shortage of 55 CNAs just at that time period. And it's a lot of work to put out a CNA. People might think it's an easy job, which it's not. I mean, I was a nursing assistant, and honestly, when I got my RN license and I promoted from nursing assistant to RN, I was so relieved because being a CNA was so much stress. But it's a great skill for everybody to have. And so we met with them, and, we decided that, I talked to the nursing faculty. We just didn't feel that 8 hours was workable. And so we came up with a short course, a 1-week training program, 8 hours a day for 32 hours of online training. And we did use one of the training that Colorado uses. We used their 13 hours supplemented with our faculty. We did it live with Zoom, fully online. And then the hospitals and HSP, Health Services of the Pacific, spent 3 days doing hands-on skills practice and training with all of these candidates, the participants. And so, in a matter of a week, we were able to get them trained and out, and the hospitals and HSP hired them.
So 24 is a good number, but there's still that huge shortage. So is there another batch that's on the way?
Yes, Andy, great question. So GCC, thankfully, Dee Mangonia, who runs the GCC program, GCC and I, we were activated at the same time when the state of emergency happened. And we were activated under the nursing resource, command post. And our primary function is to boost the staffing, right, in any way that we can. And so I told her, she was involved in the planning from day one. And I told her, there is no way that UOG can pump out 60 nursing assistants. Plus we have 35 junior nursing students and 29 seniors. And we're in the middle of getting them through their practicum and their theory. So GCC was great and stepped up and said, okay, Margaret, so I'll do 30 and GCC will do 30. And we both tried to start with 30, but for us, we ended up with some people dropping out, which is, understandable. And so we ended up completing 24. And GCC started 30 and they're in the middle of their program now. And so, it is a pilot. The Board of Nursing was instrumental because we had to get permission from the board because this is a whole new, it's a whole new world. And we had to meet with the governor because I have our geriatrics workforce enhancement grant from HRSA does pay for some funds for nursing assistant training, but it doesn't pay for everything that we needed to put out this innovative program. And so we met with the governor and she was great. She approved it on the spot. Well, I sent her the proposal ahead of time. But a couple days later, she approved it and she funded a stipend for them, as well as some of the resources like this online course that, we got from Colorado that we're using. Because that's about $150 per student. And that was not in my original budget. So we're very happy that it was really, I have to say, it was really a collaboration. And, this really shows the spirit of our healthcare infrastructure, where we had GMH, GRMC, Health Service of the Pacific, UOG, GCC, and the governor's office. And without that collaboration, there's no way this could have happened. And like I said, it's a pilot. It's in the early stages. We had some students decide that, this wasn't the right thing for them. But we've had others that are just reporting, one individual was working at GMH already through a Department of Labor grant for displaced workers. And he gave me goosebumps because in the informational meeting, he said, working at GMH in environmental services changed his life. And because of that and meeting the nurses and the other aides, he said that's what made him decide to jump into this program. And because this is asking a lot of a person. You're going to be out there giving someone a bed bath, getting as personal as you can get with another human being, and risking your own health and safety. And so we included COVID training. We included things about, stress reduction, deep breathing. GMH and GRMC were very upfront about, this is a COVID response. This isn't just something to put on your resume, right? So it takes a special kind of person to actually want to work in this field and want to be a nursing assistant because it is a difficult job.
Well, there's a lot of special people at the healthcare facilities here. And have you seen an uptick in people that, since we're in a pandemic and they see what the nurses and doctors are going through, have you seen an increase in people interested in helping out?
Well, I will tell you, I was shocked when we decided to recruit, right? And like I said, we didn't go through the media. And the reason we didn't was because as soon as we put out a flyer, and I only put out the flyer to the nurse managers. We have a chat group with all the nurse managers, and including the private sector and outpatient. And within the first day, we were getting over 50 calls. So by the weekend, we put it out on a Thursday. By the Monday, we already had 200 interested people. Wow. And so GCC had similar response. We had 100 applications, and GCC's was similar. So yes, I believe, and we heard the same thing from a lot of people that, they wanted to help. We had someone that just said, yeah, I don't have any healthcare background, but I want to help. I want to get in there and help people. And remember, this was in October, November, and the COVID numbers were just crazy, and there was a lot of fear. There still is a lot of fear, but now with the vaccine, we've got that, we've got hope, right? But still, we still are short. And what I found out last month, and I feel kind of bad, but we do have a shortage in outpatient arenas, right, for nursing assistants. We need nursing assistants in every group home, and people that do in-home supportive services. And so we started our CNA training, our regular CNA training, which is a 2.5-month program. We started that back up with the group that we had postponed in March. And so we've got 20 of them, and they're at GRMC this week and next week doing their practicum. So, I got to just thank them too, because they didn't drop out. And these are individuals, most of them are actually working for the Mayor's Council and CSS already, Catholic Social Services. So yeah, Andy, there's a lot of people that are, really just want to do this. Yes, it's a job, and yes, you get a paycheck, but being a nursing assistant, I feel, is one of the hardest jobs out there. So the fact that they want to help their fellow person, right, throughout this pandemic is just, it's a testament to their strength.
I was just curious, the breakdown said a majority of women, men, younger people.
So this is what's really interesting. And I taught CNAs before I taught BSNs. I lived in California and I taught CNAs for about 3 years. And I got to say, it's like being a den mother. You have a really wide variety of people. At CNA schools, you have a lot of older women coming back as a second career, or they've raised their families and they decide they want to go back to school. And so it's very heartwarming, because these women will stick it out. They've raised kids. Mm-hmm. They've juggled a lot of different things. And the great thing is they know how to problem solve. And let's say you get a patient, you're lying in the bed, maybe you're a hospice patient, or maybe you're a COVID patient. These are people that already have that care and compassion, because I can't teach someone to be caring. I'm not, by the time I get a student, if they're 20, 18, 20, 30, 50 years old, right, they've got to have that caring in them. We can role model it, so I love having these older students, because they don't take this lightly. And in fact, the woman that's in the photo in our press release, I love her. She would come into class, beautiful hat on, all dressed up, and it's online class. What the heck? I'd probably be wearing my pajamas. And she's working at GRMC in the telemetry unit. And yesterday when they took her picture, she's all smiles, and just seeing her through Zoom, you could just see the energy. And I heard yesterday from the nurse that's there that, the one thing they're saying about her is she has so much energy. And she's an older person. She was a nursing assistant in the States, moved to Guam, right? And so this was a great opportunity. But we do have some males. And I got to tell you, and I don't mean to be gender biased, Andy, our male students, particularly if they come in older or from a second career, they are great. Like this one, Javon, I love him. And he was in the media, so I'm not breaking confidentiality. Javon, he was the one that said it changed his life. And I mentioned before, so he was one of the DOL displaced workers. And, you guys have saw the ad when DOL put out an ad saying, we need workers to help sanitize at GMH for COVID. And I thought, who the heck is going to apply for that job? I mean, hello, I've done a lot of things, but I don't know that would be first on my list. And this man is doing it. And I believe his job before was a bus driver. But anyway, yeah. And then we do have some young people. I tried to get a diverse range, all different ethnicities, different age groups. And it's good to have some of the younger ones. Some of the younger ones were scared, and, we had one even change their mind, but then they talked to the other ones that are still still working at GMH, that were successful. And the great thing with GMH and GRMC is we've had a few say, hey, I don't know if I want to do it. They took a day off or a week off even. And now they're saying, hey, I want to come back. And the nurse managers are saying, okay, we'll take them back. We'll train them. So, we're really happy with this partnership.
Well, thanks a lot, Doc. Any other programs or anything else coming out of the UOG School of Health?
Well, I'm proud to report that, working with public health, they've been letting our senior nursing students and myself and another faculty go with them on the mass testing. And so the students have been learning a lot. They've been out in the community. Public health has been so gracious, and where we may help them with the mass vaccinations as well. And so we're very happy about that. But we are progressing our seniors so that the goal is to graduate them in May if we can, right? Because that'll be 29 other nurses. And the nursing students that graduated in May are all working at GMH and GRMC. And I just got to give a shout out to them because, you start your career in a pandemic, who could have imagined? And there's a lot of stress and a lot of fear. So I have to thank the nurses that are working there, that are mentoring them. And of course, the community, showing a lot of compassion and understanding for the nurses and other healthcare workers. People can criticize, the infrastructure at GMH, the old building, but you can't criticize these men and women that are, especially the young ones that are willing to work and not sit it out. Even my senior nursing students, I gave them the opportunity to take an incomplete if, because of stress and the pandemic and other issues that may come up, and they all stuck it out. So I've got 29 seniors moving ahead and 35 juniors. And so I just really, want to say there is hope. People are still, we're still trying to do what we can to move things along. It's not easy, but we're trying. So thank you too for all your support.
Real quick, Dr. Hattori, hi, Vic here. I don't know if you remember me. We did
Yes,
I
of
had
course.
you on
Great job.
the tribute for Eddie Boo. That was such a beautiful message you
Yes,
had for
yes.
him. But I had a question. A caller just called. A lady was asking, she was so interested in what you were talking about, and she was wondering if there were, if you guys are going to be accepting more applicants later on, and how do they go about doing applying and stuff like that.
Well, GCC is doing another 30 right now, and then we are going to reassess because, there were a lot of challenges, right? There's a lot that you have to go through to get people hired and trained in healthcare. So we're going to reassess with the nurse leaders, and, as the numbers are dropping, right, knock on wood, and holiday time, we want everyone to stay safe so the numbers don't go back up. We will have to reassess, but we, GCC, UOG have caregiver training programs. And so both schools still have we still have those programs ongoing. I don't know when the next one will be. We're working with Department of Labor to see if we can start another one in February. But definitely, if you go to the UOG website, our email address is there for the School of Health. And you can look under School of Health and the nursing program. But we'll also make sure that we give out flyers if we're going to start another caregiver training. But yeah, anyone that's interested, there's a huge demand for caregivers as well as nursing assistants.
Sounds like you need like a waiting list or something like that.
Yeah.
A sign up for it.
Yeah, you mentioned the shortage, I believe in the email, it was 55. Is that island-wide or just GMH?
No, and that, Andy, great question. And that's where, it was such an urgent need, so I focused on acute care. But we are finding in the outpatient settings, the people that do in-home support services, because caregivers are still doing home visits in the home care agencies, Catholic Social Service, because, they've got all the group homes and Guam Behavioral Health has group homes. And so there's shortages in all those areas. And so we're trying to figure out, it's so hard to juggle because I need to get those BSN students, right? And it's so hard to juggle offering caregiver, CNA, and the BSN. So we're working hand in hand with GCC to try to see how we can stagger, because they're also working on graduating their practical nurses. They have a batch that needs to graduate this month. So, we're we're trying to time it out. So I'm hoping February, maybe we can start another cohort of our regular CNA. Because the
Well, I hope
temporary,
someday we have a surplus so these nurses can get some time off after this.
yeah, definitely. I agree. We all agree. And the key, I think, is for Guam to continue to, you guys keep promoting it, wear your masks. There's a lot of concern as we are opening up and loosening restrictions, right? That we don't let our guard down and that the numbers go up. The healthcare people are really nervous. As the governor was speaking right in her press conference about reopening, I was having goosebumps thinking, oh my gosh, and already we're seeing more people having Christmas parties, work parties, and people that don't live together eating out. And so we just have to be mindful that, that's a very, very high risk, and I got to thank you guys. Andy, you shared a lot about your story and just cautioning people that we still have high risk individuals. Our elders are still at risk. And so just be careful through the holidays. You guys are doing such a great job. I really appreciate it.
Well,
Thank you, doctor. Thank you, all the nurses, everyone out there that is providing that care, acute care, outpatient care. We couldn't get through this without you, so thank you.
Thank you very much.
Merry
And happy
Christmas.
holidays.
Merry Christmas.
Merry Christmas. Thanks.
Merry Christmas.
Thanks.
All right, we are going to take a break. Coming up next, we've got Dave Delgado, who's going to be joining us in the Zoom room with